In this question, you have to identify the hormone releasing intrauterine device, that is IUD. Option A, Lippes loop. It is incorrect because it is an inert IUD made of plastic and it does not release hormones. Option B, CU7. It is also incorrect because it is a copper-based IUD. That is, it releases copper ions which are toxic to sperms and it creates a spermicidal environment, but it does not release hormones. Option C, LNG20. Now, LNG20 is a hormone-releasing IUD because it releases levonorgestrel, a synthetic progestin, which thickens the cervical mucus, thus inhibits sperm motility. And it also may suppress endometrial growth, preventing implantation. Hence, it is the correct option. Option D, multi-load 375. It is also incorrect because it is a copper IUD that works by releasing copper ions. In this question, you have to identify the wrong statement regarding vasectomy. Option A, vasa differentia is cut and tied. This is true. In vasectomy, the vasa differentia, that is the tube that carries sperms from the testes to the urethra, are cut and tied to prevent the transport of sperms, which leads to sterility. Hence, it is incorrect option. Option B, irreversible sterility. This is also true. While vasectomy is considered effective and permanent form of sterilization, but it can be reversed surgically. Hence, it is incorrect option. Option C, no sperm occurs in seminal fluid. This is also true. After vasectomy, sperm cannot travel to the seminal fluid due to the cut vas difference. Hence, it is incorrect option. Option D, no sperm occurs in epididymis. Now, this is not true. Sperm production in the testes and storage in the epididymis continue even after vasectomy. So, this procedure does not affect the production of the sperm. It only blocks their transport to the seminal fluid. Hence, it is the correct option. Embryo with more than 16 blastomeres formed due to in vitro fertilization is transferred into option A, fimbriae. It is incorrect because fimbriae are part of the fallopian tube that captures the ovulated egg, but they are not suitable for transferring embryos via IVF, that is in vitro fertilization. Option B, cervix. It is also incorrect because cervix, which is a lower part of the uterus, is not the site for the embryo transfer. Option C, uterus. Now, embryos with more than 16 blastomeres are at the morula or the early blastocyst stage. So, these are transferred directly into the uterus, where they can implant into the endometrial lining and develop further. Hence, it is the correct option. Option D, fallopian tube. It is also incorrect because embryos at early stages, that is zygote or 2 to 8 cell stage, can be transferred to the fallopian tube in a procedure called the zygote intrafallopian transfer, that is ZIFT. But embryos which are more than 16 blastomeres are transferred to the uterus. In this question, you have to match the sexually transmitted diseases given in column 1 with their respective causative agent given in column 2. Now, gonorrhea is a sexually transmitted bacterial disease caused by Neisseria gonorrhea, and it is characterized by inflammation of the genital tract, often leading to symptoms like discharge and painful urination. Thus, A matches with 2. Now, syphilis is a bacterial infection which is caused by Treponema pallidum, and it is characterized by sores. Thus, B matches with 3. Now, genital warts is a viral infection which is caused by human papilloma virus, that is HPV, and it is characterized by warts on the genital and surrounding areas. Thus, C matches with 4. And AIDS is caused by, it's a viral infection, it is caused by human immunodeficiency virus, that is HIV, and it infects the CD4 cells, and it causes weakening of the immune system. Thus, D matches with 1. Hence, the correct answer is option D. In this question, you have to identify the function of copper ions in copper-releasing IUDs, that is intrauterine devices. Option A, they inhibit gametogenesis. It is incorrect because copper ions releasing intrauterine devices, which are normally implanted in the uterus of female, do not affect the production of oogenesis. Option B, they make uterus unsuitable for implantation. It is also incorrect because copper IUDs do not prevent implantation. While some minor inflammatory changes in the endometrium occur due to the presence of IUD, but this is not the primary mechanism of the copper ions. Option C, they inhibit ovulation. It is also incorrect because copper IUDs do not inhibit ovulation. So ovulation continues as usual in women using copper IUDs because they do not release hormones to suppress the ovarian cycle. Option D, they suppress sperm motility and fertilizing capacity of sperms. Now, copper ions, which are released by IUD, they create an unsuitable or toxic environment for the sperm. They impair the sperm motility and they reduce the sperm's fertilizing capacity by disrupting their normal function and thereby preventing the fertilization. So this is the primary mechanism of action of copper IUDs. Hence, it is the correct option. In this question, you have to identify the technique that will be suitable for fertilization in case of a couple where the male is having very low sperm count. Option A, gamete intracytoplasmic fallopian transfer, that is GIFT. Now, this is incorrect because this technique involves transferring both sperm and eggs into the fallopian tube for fertilization to occur naturally inside the body. So, it requires a sufficient number of viable sperm. Thus, it is not the ideal cases of very low sperm count. Option B, artificial insemination. Now, this technique involves collecting and concentrating sperm even from a low sperm count and then introducing it directly into the female reproductive tract, usually the uterus or the cervix. Hence, it is the correct option. Option C, intracytoplasmic sperm injection, that is ICSI. Now, ICSI is also a suitable technique for very low sperm count, but it is more advanced and it is used in conjunction with the IVF because it involves directly injecting a single sperm into an egg. So, it is not the first choice when simpler methods like artificial insemination can be effective. Hence, it is incorrect. Option D, intrauterine transfer. Now, this is also incorrect because it involves transferring the embryos and not the sperm into the uterus.